from hearing from the same people. So it's always cool when new voices pop up. Let's bring on here GDOE Superintendent Jon Fernandez for our weekly Wednesday update at 8:14. Good morning, John.
Yeah, good morning, Chris. And yeah, absolutely. I had a meeting last week, getting my team together, and it was happening at the same time that Dr. David was doing her presentation, I guess at the press conference, and they were all like, how long is our meeting going to take? Because this is a great presentation. We'd like to, continue to listen in. So definitely her presentation was very informative,
right.
But I had a lot of folks just appreciating the new voice, in terms of the presentation and all the information she was providing. So she did get top billing last week, and people didn't want to be in my meeting anymore.
Right. She was the headliner. Hey, John, I kind of wanted to start here with, so you guys had this CARES Act funding. You did this little drive to give out for people to kind of apply for laptops, right? Did that get the response you guys wanted, or are we still trying to give away those laptops? And if so, how can people get them?
So, we anticipated and we're prepared to support around 8,000 to 9,000 applications for laptops. And where we're at right now is about 2,500 applications. So definitely, if you are a secondary school student or parent listening in, and you wanted to apply, and maybe you didn't do it earlier, or maybe you held back because we asked you to hold back to really try to address those, with the most needs, and maybe you have an old computer or something. You know what? We're really way below our expected number of computers that we would be able to give out. So please feel free to contact your school. Make sure that you get on the list and let them know what your situation is, because we do have the equipment that we can push out. So yeah, 2,500. We are looking into that. Obviously, if the internet access is an issue, then internet access is something that we have to address, and we're working to address. But the other thing is, if not internet access, we know some of the students would like to continue in hard copy. So one of the decisions we have to make by January is whether we are going to continue the hard copy model of learning. Some people prefer that or are asking for at least a hybrid version of hard copy and online. So we're looking at that policy decision going forward. So all of you who want, who we asked to go online, but you say, hey, no, I like the hard copy for now. Just keep in mind that we may not continue that, once we get to the second semester. It's something we're discussing with the board, because we don't believe it's as effective as the online version or, eventually face-to-face. So that's just an update, on where we are with that push.
Go ahead, Bree.
I was going to just say, where are you guys in reaching out to the students that haven't attended class?
So we've narrowed the number is now down around 750 students, and our social workers and our attendance officers are now working with the mayor's offices with that lower number that that we're at now. So I think about last week we were around maybe 1,000 that still needed to be either on the waiting list for the home visitations, or they were still in the process of being contacted. So we brought that number down about 300 or so, 250, and now we're waiting for the authority to go out and do home visitations. We hope that number will come down, just because we've finally get contact. Maybe they will call in, because I think what my social workers have been telling me are several things. Some of the families have moved. They lack phone, regular phone access. They lack transportation to be able to go to the schools, so they haven't been able to contact the schools. Some of them apparently, are in housing situations where they don't really want to, report to the school and, provide information that they feel might get them in trouble. I mean, there's a lot of these different issues that we're hearing. Obviously, that's not really our primary concern. Our primary concern is getting them connected. So we hope that we can still reduce those numbers, but the home visits are really important. And until we're able to kind of get out in the community, it's going to be difficult to really tackle, this last group. Let me tell you why. Our nurses are deployed right now to public health, and many of them are up north doing the rapid engagement, the testing, the contact tracing, and so forth. And they are telling me that what they're doing is they're focused in areas where a lot of these families, again, large families, lots of kids in the household, but really kind of disconnected from a lot of things that are happening in the community. I mean, even in terms of just being aware of the safety practices, if you don't have running water, it's not really clear how you're going to teach your kids to wash your hands regularly. So we're in situations like that where they're looking at, we don't have running water, much less a car to go to the school to pick up the hard copy, lessons, maybe not even the food. So much less being in contact with with the teachers and so forth. So that's 750. We anticipate that a number of these children who are in this category of homes who are being visited now are some of the same who are on the list. So it really is heartbreaking because our nurses are coming back and telling us, man, these kids are there, they're running around, they're playing, they're happy, but they have no connection to what's going on in terms of school because they've got other issues that have arisen just due to being shut down. So I don't know. We're looking at it with our social workers. Want to talk with our mayors about any additional types of supports we might be able to provide in these areas. But again, that's what we feared we would find, and it's what we're finding. Except now it's through the public health efforts.
Mm-hmm. What are your thoughts on Dodea? As I understand, I think it's next week they're going to start, or is it this week, starting face-to-face.
All through this, we've been really kind of focused in on GDOE and our community because we know that many of the private schools, as well as Dodea, might have other factors and other issues that they're trying to deal with. So we've always felt that, the other school systems, obviously they can make their determination and decision once the governor authorizes it, at least on the local side. And for Dodea, we know that at the federal level, there is an ongoing national discussion, but of course, been pushing for schools to open. So we thought, that Dodea might be among the first to open up. And so we hear that, and we've seen it now with their announcement. Now, of course, many of us have connections to people who work, at Dodea or whose children go to Dodea. And so it's kind of interesting just to listen in and try to, see what they're going to be doing, to implement safety protocols, but also, what they're using as the rationale for reopening. But what's different on base is the parents there are really pushing, for their kids to return to school. For our community here at GDOE, we have parents all over the spectrum. So, it's not been the same push. And we're also looking at, our basis for making determinations. And I think as I've shared it publicly, we really are leaning on the Centers for Disease Control framework for risk assessment. And right now, as you can guess, we are not trending in the right direction. So the number of new cases is about, per 100,000 people over the last 14 days is around 644, per 100,000. And I think our 2-week positivity rate is over 14%. And that puts us in the very highest risk category based on CDC. I mean, we're not even close to the threshold. So for me to put that out there and then tell parents we're reopening next week is not going to make a lot of sense. So what we did last week, after the show, later in the week, we did make the final determination that, we are not going to be implementing or returning to face-to-face instruction for the rest of the second quarter. And I know that the governor hasn't authorized to do it yet, but we wanted to also be clear that even if the governor did authorize it in the middle of the quarter, we weren't prepared to just turn around and bring everybody back midstream. So the earliest, and again, I want to make this clear because the minute I put this out there, you had half the people saying, oh, great, we're not going to do this for, at least for another 3 months. And the others are saying, hey, you're opening in January. We should be closed all year, right? So I just want to say that the message is the earliest that we would consider opening is January, but it really does depend on 3 things for us. One is the community health situation. We have to get back into a position where the governor authorizes us and we feel comfortable looking at the data that we can address the risks that are in place. The additional months, I mean, the weeks that are leading into the next year, we also want to use to make sure that all the mitigating efforts, all the supplies and equipment needed at the schools are in place and that employees are trained. And then the third thing is we do want to bring our stakeholders along with us. So we do plan to frequently kind of survey our parents, our teachers, our staff, and our students to kind of understand what those critical concerns and issues are for them in order to feel comfortable going back to school when that time comes. I think that when that time comes, it won't be just a matter of saying we're going to go back to school. We do still plan to keep options open for distance learning. So it really will be for those who say, I really do want to return face-to-face and I feel it's safe. But those who say, hey, I'd like to continue online, we still want that option to be offered. Also, we're looking at phasing in. We're not looking at just having everybody who wants to go to face-to-face come back. We're looking at maybe prioritizing whether it's the elementary schools or certain grade levels or certain, there are students with disabilities and their families who really do want to come back to school to get services that are only offered at the school setting. So it might be a phased in approach when we get down to it, but our task force, our planning group is really working hard. They reactivated this week to revisit the plan, to update things, and to start looking at these new, ideas and options.
Mm-hmm. We do have we have a comment for you from one of our people online. With this COVID-19 and this online school, I urge you to please have all teachers communicate with their students and not wait for a progress report only to find out that a student failed to turn in a homework when in fact the work was turned in with Google Docs. Just remember that on-class is still new to these students and we are all in a learning process. I just wanted to share that with you.
No, we're absolutely there with you. I think parents, please make sure, I appreciate that. We hear that a lot. We also want to make sure that you're in contact with your teacher. And if that's not working, with your administrator so they're aware, because not only are we trying to, really reinforce the communication side of things. And again, some of our parents are saying they're communicating with us too much. So, again, it's all over it might be all over the map in terms of, teacher by teacher. But we are reinforcing communication as one of the key, issues that we need to address through through distance learning. And then second, on Friday, the board also approved a change to the grading policy so that, you didn't end first. We're not issuing grades for the first quarter. It's basically going to be a progress report end of first quarter about where your students are and based on the work that they've been able to submit. And hopefully through that process and all through the upcoming parent-teacher conferences, which will be virtual and spread out over several days, the parents will be able to understand, what the issues are and overcome some of these maybe I call them glitches, but some of these issues that have arisen in the first quarter that we know have made it difficult for some students, on a day-to-day basis. And for instance, we get those alerts when the power is out, and so when they say, hey, power's out in Maguilao, we already know, the schools in Maguilao, the teachers and the students are all going to be saying, hey, we got cut off in the middle of our class, what happens? But we know that that's out of their control. So we want to, work with the families to make sure that they know that's not going to be held against your child because they were online and they couldn't control the power situation. So, things like that.
Where are you guys with educating children with special needs?
So, again, that's one of the the ongoing conversations. So right now, we're constantly in discussion with our special needs families and their advocates. There are very strong advocates out there who are pushing to try to get services delivered. And unfortunately, because of where we are with regard to the shutdown, it's very difficult to be able to meet some of those expectations, without having, without the schools being open. So that applies to all students, and that's really been a challenge. And we've been working on a case-by-case basis to try to figure out how to address the needs of those students. We've been relying in some cases on teletherapy or the basically kind of remote, supports for the students. But in some cases, the parents and the students don't feel like that's going to be, that's sufficient. and want other options. So it's not very easy at this point. That's why, as we look at the possibilities of reopening, I'm very open to looking at the cases in which we might work with those families to allow them to be among the first to be able to return and receive services, at our schools, because we know that they're being impacted significantly. All of our students are, but definitely our students who are, who require services and additional services or related services. We know that they aren't being able to receive many of those services during this shutdown. So that's why I'm saying, looking at phasing in, because we want to make sure it's safe to return. So we don't want a high volume of students coming back all at once and then testing it out. If we have to identify groups with priority, and prioritize those groups, students with special needs and in need of special services, I would venture to say they would be among the top priorities. But of course, we want to make sure that's something that the parents, continue to support, as well as the advocates that are working on their behalf.
But they're not being left behind. They are receiving some form of education.
Well, yeah. So no, they're in contact. They're receiving
Okay.
as much as we can provide, through the models of learning. But again, if you require, occupational therapy, physical therapy, other things that are normally delivered, face to face, those are the things where we have to modify the plan and try to figure out how to provide services or make sure that when we come back, we can recover or compensate the students for the services owed.
Is the Department of Public Works, are they engaged in the discussions that you guys are having with regards to when you return to face? Or is it just
They
too
have
early?
been in the past. At this point, they have not yet been re-engaged on this phase of the reopening. So, but they will be. So, during the summer, they were engaged, and we worked on the safety protocols and tried to understand some of the issues that they might have. I think the key concern has always been the number of buses available, bus drivers, and the safety protocol. So we will revisit that. I had a conversation with the Lieutenant Governor as well. I said, those Dodea buses, I think you guys might have mentioned it. Those Dodea buses that they are, purchasing new ones, and they have working buses, but it's just a matter of their regular replacement. Those might be available. So I definitely went over there and said, hey, have you guys looked at the buses that might be surplus at Dodea and see if we can get those? And I think they worked on trying to get some of those to just supplement the bus fleet. And hopefully that'll make sure that we have enough buses with social distancing to ensure the safe transportation of our kids.
Do you have a new number on just how many GDOE employees, workers have tested positive and
I
identified
think
through
the
contact
updated
tracing?
number is around 70, because I think we had a couple yesterday. So these are 70 employees. And again, we discussed this before, we're not even open. And when teachers come to school, they're instructed to go right to their classrooms, just avoid, any contact at all. But still, because it's so high in the community, our teachers are, these are people who may not have been on campus for several weeks who are reporting, and we're just happy that they are reporting it to us, because it just helps us, share the information and track the information. But again, we're not the only agencies with cases. It's just that we want to be in the practice of reporting them out. So it is concerning, 70 out there, and we try to, once they get into the hospital, if they get hospitalized or receiving medical care, we really don't know too much more about the details, but we do care about their well-being. And so, we are glad that they let us know. We take the necessary steps at school to contact trace as needed, clean if they were on campus, and then, just pray for the welfare of our employees getting back to good health.
All right. Well, thank you so much, John. Was there anything else that you wanted to get out to the community?
Yeah, no, I think you guys were talking earlier about contact tracing, and we are the largest agency in the government, and we are thinking ahead about the need to have the internal capacity to run our own contact tracing if need be, because we're such a large agency. And so we do benefit from the fact that almost all of our nurses are deployed and with public health and with the hospital, and they've received training on contact tracing. And then we have additional around 20 employees who are working with UOG to go through training on contact tracing that they had. And I believe there probably will be about 10 of them who will be able to support a pilot project that UOG is working on to establish, a contact tracing center and really kind of see how that works. Well, our intent really is to take what we learn and build that same type of infrastructure in our schools when we return, with the nurses back and playing a critical role in that contact tracing effort, but also additional staff trained and able to train others. So yeah, that's an important thing you guys raised going forward. It's going to be a way of life that we have to be ready to contact trace if things happen.
Right.
And again, the speed, the turnaround of that contact tracing is so important. So relying on other overly strapped agencies really isn't a strategy that we can be satisfied with. So we're trying to look ahead and train as many of our employees so that we can have an internal unit that can support public health, in those efforts.
All right. Thank you so much,
Yep.
John.
Oh, John, just real quick, because I know you caught that interview we did with the GORA director, Ray Tapasi, yesterday, talking about how GORA had committed some $12 million in, was it grant money, Bree?
Yeah.
Yeah, to build,
For some program.
to help build a charter school. And then, of course, we had kind of taken him to task about why didn't we do something similar for Simon Sanchez or, any public schools for that matter. And he seemed to indicate that that could be an option moving forward, maybe in the next grant cycle.
And on top of that, if they construct this new charter school, this is something that's going to come through GDOE's budget, right? To maintain and everything else like that. And are you guys prepared to handle that?
Yeah, I'm not, I'll have to get more information on that. My understanding is that they got a Section 108 guaranteed loan for iLearn, and that that would be GURAS assisting them in being able to build a school. And I just got to say, iLearn has been one of the maybe unsung charter schools that have really done a great job. They've kept under the radar, but they've been able to maintain their program and sustain their organization and even get through COVID-19 pretty smoothly. So we do applaud them in that effort. And frankly, I've been over to their facilities, and they could stand to upgrade, with the right support. So I don't have any issue with them getting support in that way, because I think they've proven that they've been able to be successful. But the issue is with regard to the 108 loan or other finances, we'll be working on that as part of our next phase. I mean, Gita is going to really be our key partner in that. I mean, our next phase really is to bring in, based on the law, we're bringing in vendors who would not only construct, but would also finance their, the project. And then, through a leaseback program, we would be able to pay down, what is owed, as part of that deal. So Gita's role is to really help understand how to make certain financing mechanisms available, for that project. So whether it's with working with GURA to see what grants are might be eligible, or what loan programs might be available, or through USDA, which is another option. We're going to be looking at Gita to help make those connections and kind of help work us through that process. So our timing on that is hopefully, the design process, it's already started, and the schedule's being put in place to start bringing in the stakeholders to start talking about what they want to see and get that design going. But we're hoping by next summer to be already moving forward with the procurement of the construction and financing, so we can get to a groundbreaking as soon as possible. So that'll be coming up over the coming months, that discussion about financing and construction.
Right, but just for clarification, because you said, this is some sort of a loan through GORA, GDOE wouldn't have to provide any sort of financial payments or anything for this charter school?
Yeah, I'm not aware of that GDOE would be on the hook, or whether they would incorporate any type of repayment through our budget. So that would be something that we would have to see for the next appropriation cycle. But I have looked at the program. That program really does give out, much smaller loans than we probably need. I think the max they gave out this last year was about 23 million. But that was for a really complex, multifaceted, development project in North Carolina, I believe. So we're probably around double or more, in terms of our need for financing. But if they can do portion of it, hey, that helps.
Thank you, John.
Thanks, John.
Okay.
Hey,
thank
we,
you.
we got a
Have a great day.
virtual Masubi. There's the Pico one and then the regular, and then we've also got the Navy biscuits virtual. Okay.
I'll load up on the way out.
Yeah, take some of the staff. Okay, John, we'll see you. We'll take a really quick break. Coming back with Dr. Annette David here on the link. It's The Breeze 93.9.